Today I'm going to talk briefly about innovations in early intervention, in education for children with autism, and what we might expect in changes that may happen that will affect the future of services. I think one current direction in research is in the development of intervention models for infants and toddlers with autism. We're beginning to identify children younger, down to the age of 12 months sometimes. There is a need for designing interventions that specifically match the developmental characteristics of the children and the families, and a realization that the models that we've used for older children, for preschool-age children, elementary-age children, don't fit. So now there's a network of programs that focus on toddler intervention and approaches that may promote early communication and social skills, joint attention, family interactions with children, that may well have a major impact on the later skills and learning and development for those children. A second innovation, I think, is the evolution of comprehensive treatment models for perhaps for toddlers, but also for preschool children and youth. We have for many years had programs comprehensive treatment programs that are designed to deliver a package of interventions, a package of effective procedures for children. For example, the models that come from the Lovas Institute now, or DIR floor time work by Greenspan, pull together a set of practices that can be delivered as a group. We often know the effects of individual practices, but we may not know how they work in combination. And those we call comprehensive treatment models. They exist, they are implemented over perhaps a year's time period or longer, and they're made up of, the models are made up of multiple components. In the future, we're going to have much better information about the efficacy of those models and the effectiveness of those models. We do have some information now, but there are studies that are going on that are going to tell us which are effective for children with autism, youth with autism, and families, and which may be scaled up to use in school systems on a larger basis. Related to that, there's an emerging science within education, mental health, prevention science, called implementation science. It's an examination of what factors, what supports are needed within systems to allow evidence-based practice, or perhaps those effective comprehensive treatment models that I just talked about, to be employed on a larger scale. Right now, we are starting to get very good information about research-based practice or evidence-based practice for focused interventions, but we don't know as much about what needs to happen within a school system or within a community that would allow those practices to be employed with a high degree of fidelity, or what may lead teachers or families to be able to use them well in schools or in homes or communities. That science is very much coming into the forefront in mental health, in education more broadly, and in special education. And I see that as being a great support for the use of practices, or actually employing evidence-based practices in the future. Last, I think technology, in the evolution of technology, is going to have a major impact on the work that we do with children and youth with autism and their families. The development of alternative augmentative communication systems that allow children to communicate when they can't necessarily use words, at least initially. The use of PDAs to allow children or youth, adults with autism, to take their schedules with them and to have prompts for what their next scheduled event is in their life. Already is assisting the lives of many individuals with autism. The ease with which one may capture video digitally, that is on camcorders or digital video systems, and upload those to a central source, also may well assist us in working with families who may be in remote communities. So now parents can very easily take videos of their children in their everyday activities in their home or the community and share those with early interventionists who may be miles away and receive communication from them. It can be a very interactive process. And I think that the prospect for that technology affecting children's lives and families' lives is quite good. The use of virtual environments may well be a mode of instruction or introduction of skills and practice in the future. So learning about social skills through either video games or through video technology, internet technology, may well serve as a mode of instruction, a mode of practice for us in the future. And there's already research on how adolescents with autism may learn to interact in an effective manner. So I think those are among the prospects that may affect the way that we, as educators, as early interventionists, speech pathologists, work with children and families in the future.